I came across CV247 in the year 2000. An interesting story. I was looking after a patient at the hospice where I was medical director at the time, still am in fact, who was doing very well with a serious lung cancer. He was doing better than he should have been doing. And I was interested to know what was keeping him so well, and he said that he was visiting a vet in Harrow. So being curious, which I think most doctors should be curious, I found out more. I contacted John Carter, the vet in Harrow, to find out what he was doing. And from that date have maintained an interest, passionate interest really, in the science behind CV247, the research and its potential as a use for patients with advanced cancer. Following on from that, I began to do some joint clinics with John Carter in Harrow and saw over a period of 3 or 4 years, nearly 5 years, over 160 patients with a variety of cancers ranging from lymphoma, breast cancer, thyroid cancer, kidney cancer, prostate cancer, and was astonished at how well some of them, not all of them, were doing. Many patients felt better for longer and didn't follow the natural course that I would have predicted in my conventional healthcare practice. So, for instance, pain improved, breathlessness improved, nausea often improved. I found that the medication was very well tolerated, very few side effects, and felt that research was needed to really try and introduce this as a non-toxic form of treatment that would support patients with cancer. A few particularly startling cases was the patient with kidney cancer who had spread to his lungs. He refused or chose not to have conventional treatment, and his lung secondary cancers slowly disappeared over a period of time. Now, kidney cancer can sometimes do that, but it's very rare, and he's had no recurrence since. Many other patients certainly had a longer period of life than I would have predicted. I'm just thinking of a few other special patients. There was a patient with malignant melanoma, which is a very serious skin cancer that we get from being in the sunshine too much. And again, they'd been given 2 or 3 weeks to live by one of their doctors and actually lived 9, 10 months with a good quality of life. The other interesting thing about CV247 is that John Carter believed that what was also important in the treatment of cancer was a very good, organic, additive-free diet. So many of the patients who did best actually really stuck to a very healthy diet, which was also low salt and low in sugar. But I never felt that that was the complete answer, because if diet was the answer to cancer, then we'd all be out of a job. And many people are on a very healthy diet with cancer, but the cancer is still progressing. So it was almost as though CV247 together with a good diet really seemed to help. Then followed on in 2003, 4 and 5, a series of research projects. I was involved with one at the hospice where I work, and there was another one with a group of patients that John Carter was looking after. And the conclusions really, they were difficult because they were small numbers, but what we found again was that the medicine was well tolerated and patients seemed to do quite well and improve their quality of life. So symptoms improved. It's always difficult to say how long somebody would have lived without a treatment, so I don't know, but I did get a sense that people were doing well on this medication, and I'd really like to see more research being done that guarantees it a place in future healthcare.